As you all know, the chat is on hiatus this week again, but we'll be back next week. But to keep things active and going, I wanted to bring to you some topics, some conversations with some very important people. So I am here at Memorial Women's Health, and I am at the office of Dr. Angela Martin. She is an OBGYN. Dr. Martin, thank you for taking the time to speak with me today.
Thank you.
Walking into your office, this cabinet really caught my eye. So if you don't mind, can we kind of walk over and talk about some of these items you have here in this beautiful antique cabinet. First of all, the cabinet is actually gorgeous.
The cabinet is actually an antique that I purchased when we moved over here to this office location. I'm a big fan of antiques. That's something my husband and I used to love to do together.
And I'm going to pause you right here for a moment to talk about your husband. You're a lot of people here in Jacksonville will know your late husband, Dr. I keep calling him Doctor Chef Robert. He was the Winn-Dixie corporate chef
for Winn-Dixie Supermarkets
for a number of years.
For 12 years, and then a First Coast News personality.
Yes, we remember that.
Remember?
Yes, yes. And we're very, very sorry for your loss. Very sorry. This cabinet kind of speaks to what I don't want to say your like, but what your likes are. You have a couple of antiques in here. This beautiful doll back here with the shoes in the hand.
Yes.
How long have you had this piece?
Oh, I've had that piece for probably 10 years or so.
Wow.
Yes, I like to collect antique baby pictures. I've got baby shoes. The dolls are something I've become interested in, and I'm very interested in more of the ethnic dolls.
Why is that?
Just because they're very hard to find. I don't see them very often, and I like to incorporate that into my decor, and it's just something I have an interest in.
Wow.
So I've done a lot of this collecting has occurred over several years. I've got a huge collection of antique baby pictures in the walls of my office, my examination room. I just find it fascinating to look and see how they dressed the children years ago and the kinds of pictures that they took.
That's awesome. That is so awesome. How long have you been collecting dolls?
Oh, several years. I would say at least 15 to 18 years.
That's awesome. And you have an actual gold-plated shovel from 2007, the groundbreaking of the new wing of Memorial Hospital. Tell us more about that.
That was the groundbreaking for the West Tower, which went up in that year. And at the time, I was the president of the medical staff, so I got to participate in the ceremony. So that is my commemorative shovel.
I'm sure that's an event that you will not forget.
Yes, it was a big stage for the hospital has undergone a lot of transformations. It's continuing to grow and expand.
That's awesome.
And I think that's a wonderful thing for the community.
Absolutely. Well, now that we've talked about your likes, what you like to do, I would love to have a kind of intimate, personal conversation with you now about the vaginal health.
The V word.
The V word. Are you okay with that?
Yeah.
Sure. Let's have a sit down and chat, Dr. Martin. So, it's one of those things that it is what it is. Every woman is born with one, and we have to take care of it.
Yes.
However, there are some people who may not know how, and may not know the whys and all that. So that's kind of what I want to talk about today, to bring those questions. Vaginal health. How would you recommend a woman keep a healthy vagina?
Well, a lot of women are under the impression that they've got to do something. They don't really have to do anything. The body has its own mechanism of keeping things in balance. So provided that there's not maybe certain medications or certain behaviors, the vaginal health is something that's regulated by our own bodies. So therefore, it's not necessary to put a lot of things in the vaginal area or cleanse the vaginal area with special soaps or
you hear that, ladies?
Hygiene products.
Wow.
And douching is another prime example. People think, well, that's going to make me feel better or become more healthy. But what that does is it disturbs the normal balance of bacteria that are in our vaginal ecosystem. And once you disturb that, then that's where women get into problems with infections and symptoms
really?
and other problems.
So let me ask you, if that's the case, why do they sell them? Because for the longest, I thought that growing up as an adolescent, I thought that is what you had to do in order to keep a healthy vag area.
Right. That may be something that's just a cultural phenomenon, maybe because women are uncomfortable with their bodies. And it may be marketing that's kind of the way people think, oh, I should do this because it's going to make me feel better or be quote, fresher. Maybe women are uncomfortable with, just kind of the natural things that occur.
So should we never use those?
It's not that women should never do it, but it really shouldn't be done on a regular basis. Because I think it can cause more harm than good.
Wow. So what would you say would be a perfect warning sign that something may be wrong down there and that we should seek medical attention?
I think, certainly maybe an unusual discharge.
Okay.
Now, vaginal discharge is, again, something that can be normal, physiologic. So there's cells in the vaginal epithelium that produce mucus, and that is where the discharge typically comes from. And the cervix also produces mucus, which contributes to a normal discharge. Normal discharge is usually clear or white, doesn't cause any sort of itching, irritation, or pain. And symptoms of a potential problem could be maybe a malodorous discharge, something that's more yellow-green in color, bleeding, if they see some vaginal blood that's
and it's not their time of gotcha.
Itching, irritation, burning could be signs of vaginal infection.
Okay. Growing up as kids, as little girls, we go through life, and sometimes parents don't know when is the proper time to have their daughters to come in to start having and dealing with and learning about vaginal health. What would you say is that proper age for these mothers out there of young girls? What is the right age for them to start being aware and learning about vaginal health?
Well, normally we don't typically see the young patients unless they're having perhaps issues with their menstrual cycles, not so much vaginal issues, but more menstrual cycle issues. For instance, women don't need to start a pap smear screening process now until the age of 21.
Oh, wow.
So those guidelines have changed over the past several years as to when women should actually start having that particular visit with the gynecologist. Now, we do see them younger than 21, and that might be because they are sexually active. And if they are sexually active, they should get a checkup with a gynecologist to make sure they don't have sexually transmitted diseases, and they may not have signs or symptoms of that. So that's very important for them. But in general, like pap smear screening or cervical cancer screening, we don't typically start that until 21 years of age.
So you mentioned that the screening process and the age had changed. Why did it change?
It changed on the basis of a lot of evidence-based studies and looking at, number one, why do we do pap smear tests? We do it to reduce the incidence and the mortality from cervical cancer. So the pap test was instituted in, I believe, the 1950s. And since that was instituted, we've seen a decline in the number of cases in the United States of cervical cancer. So that's been a very good thing. But everybody was trained yearly visits for women. They come in every year, get a pap smear, a pelvic exam, a breast exam. And that was the gold standard for many, many years. What we found is that it's not necessary in most women to screen them that frequently, because now we understand a little bit more about what causes cervical cancer and the natural history. And in the young patient population, especially under age 21, the incidence of cervical cancer would be something like 0.1 per 100,000.
Oh, wow.
Very, very low, very unusual to see that.
Interesting. Speaking of, you guys seeing younger patients and possibly being sexually active, let's kind of transition the conversation to contraceptives, birth control. Most girls know that, and they think that birth control is the safest and the most effective form to avoid getting pregnant, of course. But there seems to be some consequences and side effects that come with birth control pill, as in, weight gain, those types of things. Would you say, with all technology, everything that's happened through the years, is birth control pill still the safest form of birth control?
Well, there's always risks and benefits with all the different methods. I mean, if you really want to be a purist about it, the safest method would be abstinence, which is obviously...
Dr. Martin, we know they ain't doing that.
Which is obviously the safest and the most effective
Yes,
in preventing
yes.
pregnancy.
But,
yes. We know that we're realistic
Mhm.
in today's age. So the pill has always been probably the most popular form of birth control, but there can be side effects from it. And we are fortunate that we've got a lot of other longer acting agents that are probably more effective and have a little bit different side effect profile. So now in that population, we're using a lot of a contraceptive called Nexplanon. Nexplanon is a 3-year contraceptive implant.
Oh, wow.
It's inserted under the skin of the upper arm. It's literally a 5-minute procedure in the office, and it provides excellent protection against pregnancy. It does have a side effect profile of a lot of initial irregular bleeding, but that typically straightens out over time. So it takes away the compliance issue where sometimes it's hard for women to remember to take a pill and they forget, and that's when things, unintended things tend to happen.
This kind of reminds me of another form of birth control back in the day that they used to put something underneath the skin, very similar. That one, from what I understand, did not have, there were a lot of issues and complications with it. And I even know of someone that got pregnant off of that. So would you say this new form is being tried and true, so to speak, and you cannot, definitely not get pregnant off of that?
There's nothing that you can say definitely not. There's
Except
always
abstinence.
failures. There's always potential failures. But if you look at the data, something like the Nexplanon actually has a lower failure rate in some cases than a tubal sterilization
Oh,
procedure.
wow.
So even tubal sterilization procedures can fail. What you're talking about was probably the Norplant. There were 6 little rods that were put in. So that was a little more time consuming, and those were sometimes very challenging to get all 6 of those rods out. Whereas they've streamlined it to where it's one, easy to insert, typically easy to remove, and highly effective. So that's it's kind of a popular choice among the younger patient population.
I have a little, maybe to some, maybe a little uncomfortable topic to ask you about now. And that is about vaginal odor. It happens. It's life. Things happen. There can be things going on in our bodies that can cause it to happen. Would you say that's correct? That odor can happen to anyone, not just a certain class of people.
Correct. It's a universal issue, and it's probably, if you asked most women, have they ever experienced something unusual or something unpleasant or something they, weren't quite sure was normal, most people would say yes.
Is there ever a point where if that happens, if you're not so fresh, should you come and see a doctor, or would you say just kind of wait it out, use something over the counter, and you should be good?
Well, I think it might depend if there's other symptoms. If it's just that and the patient does not have an unusual discharge, bleeding abnormalities, pain, discomfort, itching, irritation, it might just be, could be just a little temporary change in the bacterial content, or women that have had maybe recent intercourse could also experience that right after.
Really?
Because the ejaculate and the semen will change the vaginal pH a little bit, and that may alter.
I never knew that.
It will alter the bacteria a little bit.
Wow.
And then the bacteria can liberate substances that then result in the odor.
So backing up a little bit to the ejaculation entering, does that mean something is wrong with him?
No.
No, okay. That's normal?
Yes,
Okay.
That's a normal finding.
Okay.
So a lot of women will report, after relations, they notice that those symptoms, and then the symptoms resolve on their own, they get better, and they don't really need any sort of treatment.
Okay, so that's nothing to kind of freak out over.
Nothing to freak out about. Now, there are a lot of women who are bothered by a particular bacterial infection called bacterial vaginosis, which is really caused by a multitude of different bacteria in the vaginal system that get out of balance. Okay, it's more common than yeast infections, and it can be a real problem because the symptoms are usually a malodorous discharge, and so women are very cognizant of that. And we typically treat that with a course of antibiotics. There's also some vaginal gels that can be used, but a lot of women have recurrent episodes, and we still don't understand why that is, why some women get this over and over again and other women don't seem to have a problem with it.
Do you think there will ever come a time where medication for yeast infections will be over the counter?
Well, they have yeast infection medicine over the counter. They have monostat and some other things that are used to treat. For the bacterial vaginosis, that still requires, it's an antibiotic, not an antifungal, and therefore it still requires a prescription, at least in the United States it does.
I was under the impression that the over-the-counter yeast infection medication that's there now is only a temporary fix until you can get to your doctor. Is that not the case? Can we take that and just be done with it?
Well, the problem is making an accurate diagnosis. So when a woman has symptoms, some women assume it's yeast. It may or may not be yeast. So the idea of the self-treatment can sometimes lead to problems.
Okay.
You know, if you're familiar with your body and I know what a yeast infection feels like, and some women can tell.
Yeah,
that
that's our bodies. We should be in touch with our bodies. Yeah.
There's nothing wrong in that woman using an over-the-counter remedy, especially if it's something that's worked for her in the past.
Okay.
But if that doesn't work and the symptoms are still there, it really should be evaluated by a provider, whether it's a physician or a nurse practitioner, or just someone to get a more accurate diagnosis.
Okay. So the last topic we're going to talk about, I think, is one of the most serious ones for me, and that is vaginal health and menopause. Girl, this menopause is no joke. It's one of those things I know I can't avoid.
That's right.
But there are certain things that happens to our bodies when this is happening. Is there any way you can give us a few warning signs of what we need to look out for, or what's going to possibly go wrong down there when we enter that menopause phase?
Okay. Well, with menopause, and understand the definition of what is menopause. You're born with a certain number of follicles in your ovaries. And as you age, even from birth, those follicles get depleted. The follicles produce estrogen. And so when there's no more follicles in the ovaries, the estrogen level goes down and the period stops. So if you go a year and there's no menstrual period, as long as it's not due to some other factor, that's menopause. Average age in the United States might be 51, 52 years of age, although
I'm way younger than that.
It varies, and there's many women who will continue to cycle well into the late 50s or even the early 60s.
Wow.
You can't predict exactly when that's going to happen. But when the estrogen level falls, the vaginal epithelium is dependent on estrogen. Estrogen kind of helps to keep it healthy. So the vaginal symptoms women get into after menopause are typically that the mucosa or epithelium gets very thin, easily irritated. So they tend to suffer from dryness, discomfort, could be itching, irritation, and especially painful intercourse is another classic change that can happen.
This just don't seem fair. Why us? Oh my goodness. So is there anything we can do about this, vaginal dryness?
Oh yes, there's many things. There's a lot of over-the-counter remedies.
Okay.
So think about, just like we take care of our skin, we moisturize our skin,
right.
We take care of the skin of our face and our bodies. You can do the same thing to the vaginal.
Really?
So a daily vaginal moisturizer can help.
They have vaginal moisturizers?
They do. There's a number of products on the market.
See, this is why we're doing this video, people, to educate you. I didn't even know that.
Mm-hmm.
Shopping list.
They're in the women's health segment, and they maybe where the lubricants are.
Okay.
And there's a difference between a lubricant is used for sexual relations, and a moisturizer is used more on a daily basis.
Wow.
There's some other products on the market. There's something called Replens or Refresh, which are vaginal inserts, and they kind of do something similar. And then there's the option, if it's significant problem, vaginal estrogen. And there's many different forms of vaginal estrogen to restore what the body is no longer making. There's vaginal tablets, vaginal estrogen creams. There's even a ring that has estrogen in it that a woman can place, and it stays in the vaginal area for a 3-month time frame.
Wow.
And she doesn't feel that it's there, the partner doesn't feel that it's there, but it delivers kind of that low, steady state of estrogen to help with those types of symptoms.
Well, that is great to know. Yesterday when we posted that we were going to be here today, we had a viewer to write in to ask the question of, are there anything against her dyeing the area down there?
Dyeing?
Yeah, like making it blonde, maybe?
Oh, okay. Well, I guess that would be the same as if you did hair dye on your head.
Imagine the burning on that thing. Jamie is laughing. So is that something she should stay away from?
I don't think anybody's ever asked me that question.
That would be your first, Dr. Martin.
Well, I guess it would be, I'm not sure there's any necessarily studies or data on whether that would pose any sort of risk or complications. I'm not sure I would have an opinion one way or the other about it. It might just be a personal preference.
Okay, well, I'm sure that was a personal preference. Go ahead, girl, do your thing. Dr. Martin, it has been wonderful. I thank you for your time. I've learned quite a few things from you. I think you're great, and I wish you the best of luck.
Well, thank you.
You are more than welcome.
And you had some people from China and Arizona watching today.
Look at that. Hello,
China.
people from China and Arizona. We certainly appreciate you. As we mentioned, the chat is on hiatus until next week. We're back next week with shows. Yes, we are coming back for sure. But until then, we're kind of keeping things active here on Facebook. And if you have any questions or comments or whatever, be sure to leave them below in the link, and also follow me on my my fan Facebook page, which is Henny the Chatter, Henny, Henny the Chatter. And Dr. Martin, do you have a social media handle you want to kind of throw out there?
No, I don't. But I would like to put a plug in for our group, which is Memorial Women's Health. We have a female provider and a nurse practitioner as well. And we're taking new patients, so
very nice.
It's nice to know that in the community.
Very nice, very nice. Well, thank you guys for watching today. We're not going to take too much more of your time. Thanks for watching. Mwah! Bye.